Hello everyone, my name is April McDonald. I'm an MSN FNP student at Eastern Kentucky University, and today we're going to be talking about childhood obesity and school-based interventions while also discussing a project proposal. So obesity is a growing concern. We know the prevalence of childhood obesity continues to rise as well. The significance of the disease is quite obvious and staggering. According to the World Health Organization, obesity has nearly tripled worldwide since 1975. Childhood obesity alone is responsible for about $14 billion in direct medical costs yearly. Today, 1 in 3 adults and 1 in 6 children are considered to be obese. And we know that obesity leads to several health issues such as heart problems, lung problems, diabetes, certain cancers, and not to mention the social stigma that comes along with being a child who is obese. So we know that health habits developed in our childhood tend to continue well into adulthood. And if trends like these continue, children today could be the first generation to live shorter, less healthier lives than their parents. So the question is, in school-age children, how does enhanced school-based physical activity and nutritional education compared to standard education affect body mass index levels? Body mass index is used to assess weight status and to estimate a person's risk for weight-related health problems. A BMI measurement, it's a good outcome measure as far as being relatively easy to measure. It's inexpensive, it's non-invasive, it's quick to obtain, and it does correlate with body fat. So of course the objectives of the project being proposed would be to decrease body mass index scores from pre to post intervention, but also to increase awareness of childhood obesity issues and promote healthier lifestyle habits for children. So the project itself would be held in a high school setting, and children aged 13 to 17 would be able to participate. Flyers would be posted throughout the school as well as handed out by the teachers to students in the classroom setting that had details of the project and eligibility criteria. The student would voluntarily sign up to participate for the project in the school's medical office, and at that time they would be able to obtain the consent forms for themselves, their parents, and also pick up a questionnaire that could further help determine if they were eligible to participate. So a required meeting would be held at the school after that by the researcher to help answer any questions that the students or the parents or school staff had about the project. And at that time, the researcher would also collect the consent forms and the questionnaires to help determine eligibility. After the students were notified of being eligible to participate, they would present to the school on a specified date for pre-intervention measurements, which would include the height, weight, and body mass index. The intervention itself would include 30 minutes of daily moderate to vigorous physical activity and also weekly nutritional educational handouts for the students. And the intervention would take place over a 2-month duration. Students after that 2 months would present back to the school's medical office for post-intervention measurements on a specified date, and also complete a short survey rating their perception of the usefulness of the project at that time on a numerical scale. After the researcher had time to collect and analyze the data, it would be presented to the school for the students, parents, and school staff as far as the results in a PowerPoint presentation. So the research thus far has strong, compelling evidence that moderate to vigorous physical activity and nutritional education can help reduce BMI levels and overall obesity risk. research also tells us that things like screen time, whether it's playing video games or watching television, drinking sugary beverages, also play a huge factor in childhood obesity. And reducing these things reduces your risk of obesity as a child. But there are gaps in the literature. We need more research to determine factors like the educational level of the parents or the income status of the parents of the child. Studies show us that interventions held in a school setting are really quite feasible and cost effective, and just effective in general. When you think about it, students spend most of their day in a school setting. They eat most of their meals at school, and it's really just obviously the most obvious environment for learning or education. So in closing, as nurse practitioners, we do play a huge factor in helping recognize when a child is obese or at risk for obesity, and making sure they have the resources they need to stop the trend, to keep it from continuing into adulthood. Nurse practitioners also play a huge role, whether it's in a school or a medical office or a hospital setting, as far as adding to research and helping improve evidence-based practices within healthcare. So I just want to thank you all for taking time to listen to my presentation, and I wish you all the best of luck. Thanks.